how to deliver bad news to a patient. Here there are some phrases. 1. Mr. John, what I would like to tell you is that the cause of your symptoms could be more serious than you think, and that there is a risk that it is some kind of brain disorder. Therefore, I believe that it is very important that we do a few further investigations, including a CT scan and an EEG. 2. Well, Mr. John, it may be serious, but you are in very good hands, and the first step is to complete our investigations. 3. Well, Mr. John, we have the test results back, and unfortunately the news is not good. 4. I realize that this comes as a shock to you. You don't need to worry much, because there are some treatment options such as chemotherapy. Have you heard of these? 5. All right, Mr. John, there are some unpleasant side effects such as nausea, vomiting, hair fall. But it is the most effective treatment option for your condition. Well, we hope you will improve after a course of treatment. Definitely, we will keep a close eye on you and repeat the treatment if needed.